Good afternoon, and welcome to the Learning Without Violence, a School Violence Prevention Summit. I'm Patrick Carter. I'm the co-director of the Institute for Firearm Injury Prevention and co-director of the Injury Prevention Center here at the University of Michigan, two of the groups that are sponsoring today's event, along with the National Center for School Safety. Before we begin our program, which we've been developing over the past several months, I do want to take a few minutes to acknowledge the events of this past week. Far too often, the spaces and places that we've reserved in our communities for knowledge and enlightenment have ended up becoming the settings for tragedy. And they've robbed our children of the opportunity to discover and imagine their futures without a fear for firearm violence. I think we all realize that this has to change, that we can and we must do better. The thing that gives me hope in these moments is that when I look across our campus here at the University of Michigan, across our state, and really across the country, people do really support and have a hunger for changing the trajectory of what we're seeing today with regards to violence. And I think I speak for everybody who will be speaking today that we stand with our colleagues, our friends, families, and communities that are affected by this tragedy, and we offer them our support. I think we also know that science and research can help drive the change that's needed around violence. And we remain committed to finding evidence-based solutions to the problem of school violence. Today's conference and event, which we've been planning over the past several months, is really focused on trying to understand and explain school violence, everything from bullying and physical violence, dating violence, to the lethal and deadly violence outcomes that we saw this week. But really more importantly, focused on how we develop, test, and implement evidence-based solutions to the problem. And so with that, we'll move forward with our program that we previously scheduled. I do want to point out that on the Institute for Firearm Injury Prevention's website and on the National Center for School Safety's website, we have resources that are available for how to talk about this event and how to respond to this event. And so I would encourage folks to go to the website and explore those resources for any urgent crisis or mental health issues. Please do call or text the crisis lifeline at 988. As I said at the outset, the event today is sponsored by the University of Michigan Institute for Firearm Injury Prevention, our CDC-funded Injury Prevention Center, and our National Center for School Safety, which is funded by BJA. I wanted to take a few minutes to talk a little bit about the sponsoring centers. So the University of Michigan Institute for Firearm Injury Prevention is a broad institute here at the University of Michigan that is focused campus-wide on addressing all facets and aspects of firearm injury prevention and using the resources and the expertise that exists across the university to really drive the advancement of knowledge and scientific solutions to help decrease firearm injury, including for school and mass shootings, which is one of the things we'll obviously be talking about today. The Institute focuses on several pillars, including research and scholarship, enhancing our understanding of data and methodology to help solve this problem, education and training of those who are focused on helping to develop the solutions, engaging with the communities that are most impacted by the problem, and advancing solutions across the translational spectrum at all levels of intervention, but also including policy changes. While our institute has a national focus, we have a lot of work going on here in Michigan, and I do want to highlight that we're focused in over 20 schools across the state, in hospital settings, in communities, both in the lower and upper peninsula, and are really focused on how we can drive change to solve firearm injuries as a public health problem. We also have a number of resources on our website that I would point folks to, some online courses that focus on the science of firearm injury prevention, as well as other resources that I mentioned earlier around programs that exist that we've tested that are evidence-based, other online learning opportunities, and guides for the problem. The other sponsoring center on campus is the National Center for School Safety. This is led by Dr. Heinze, who you'll hear from in a minute, as well as Dr. Zimmerman, which really is a technical center that focuses across these 11 domains of school safety, including comprehensive school assessments, behavioral threat assessments, campus and building security, coordination with first responders, school-based law enforcement, anonymous reporting system, school safety drills, school climate improvements, providing mental health resources, monitoring social media, and empowering and involving students in helping to drive solutions, evidence-based solutions for school violence. And so you'll hear a lot from speakers today who are integrated into the National Center for School Safety and from Dr. Heinze himself in a few minutes. I also point out that in addition to providing technical assistance to schools across the state of Michigan and outside of Michigan, the National Center for School Safety has a number of very stellar webinars and self-paced trainings and toolkits and guides to help guide both implementing solutions as well as doing needs assessments in school settings. And so I'd point you to their website for more information on that. Finally, the third sponsoring center for this is our Injury Prevention Center. The Injury Prevention Center is funded by the Centers for Disease Control. It's one of the 9 centers that exist across the country. It's here at the University of Michigan and focuses broadly across injury prevention topics, including school violence and other types of interpersonal and intimate partner violence. The Injury Prevention Center provides education, conducts research, and does outreach to communities that are impacted by all types of injury and injury prevention. So I would direct you more to their website again to learn about other opportunities for learning kind of broadly about injury prevention. But the 3 groups today across campus, leading national experts in the field, have brought together this event to focus on school safety and school violence reduction. And just to turn towards the agenda, we'll complete the welcome and opening remarks here in a few minutes. Following that, we will have a distinguished keynote address by Dr. Dorothy Esplanage from the University of North Carolina at Chapel Hill. Following a brief break, we will have 2 concurrent sessions, one focused around school climate, one focused around mental health in schools. That will be followed by another break with another 2 concurrent sessions, one focused on emerging strategies for prevention, and a second one focused on existing evidence-based strategies that will wrap up around 3 p.m. All of the sessions today are being taped, and so if you missed a session and would like to go back and watch it later, they'll be hosted on the Injury Prevention Center website as well as the National Center for School Safety. If you have any technical difficulties during the day, I would ask you to email the UM Injury Center at med.umich.edu, which should be up on the screen, and will allow you to connect with one of our technical assistants who can help you with any of the technical difficulties. Lastly, after the summit ends today, we will send out an evaluation, and we would love to know about your thoughts about the topic areas we discussed, the content, and any feedback you have on ways we could continue to enhance these educational opportunities. For those that are interested, there are free continuing education credits. We have AMA Category 1 credits. We have Michigan Social Work and Chess credits available. You'll need to be present throughout the entire event to gain these and complete the evaluation survey after the end of the event. And with that, I'd like to turn it over to Dr. Justin Heinze. Dr. Heinze is an associate professor at the University of Michigan in the School of Public Health and the Department of Health Behavior and Health Education. He's also the Outreach Corps Director for the Injury Prevention Center. He is a director in the Institute for Firearm Injury Prevention of the Science and Methods Corps. And he also leads, as I already said, the National Center for School Safety with Dr. Mark Zimmerman. His research investigates how schools influence disparities in violence and other risk outcomes from an ecological perspective that includes individual, interpersonal, and contextual influences on development. He's particularly interested in structural features of school context and policy that can perpetuate inequities in violence and firearm outcomes, but also how these institutions can serve as the setting for intervention. With that, I will turn it over to Dr. Heinze.
Thank you, Dr. Carter, and welcome everyone. I really appreciate you joining us today. I'm excited to serve as the moderator of this session, and we're going to begin this summit with a keynote address. It is my distinct pleasure to introduce our keynote speaker, Dr. Dorothy Espelage. Dr. Espelage is the William C. Friday Distinguished Professor of Education at the University of North Carolina at Chapel Hill. Dr. Espelage's research focuses on translating empirical findings into prevention and intervention programming. She's the recipient of the APA Lifetime Achievement Award in Prevention Science and the 2016 APA Award for Distinguished Contributions to Research and Public Policy, and is a fellow of APS, APA, and AERA. She is also an elected member of the National Academy of Education. She has authored over 300 peer-reviewed articles, 80 book chapters on bullying, homophobic teasing, sexual harassment, dating violence, and gang violence. As a note, the presentation was pre-recorded to limit any technical difficulties, but Dr. Espelage is here and will take questions after the talk and answer them in real time live. So please remember to type your questions for Dr. Espelage in the Q&A box. And with that, please join me in welcoming Dr. Dorothy Espelage.
Good afternoon. My name is Dorothy Espelage, and for the next 30 minutes, I'm going to be telling you a story, a journey in some ways, where we have for the last extensively 10 to 15 years tried to document what I'm calling here bullying as a developmental precursor to sexual and dating violence across adolescence. And certainly when we started doing this work, there wasn't a lot of labs out there measuring both bullying and concomitant forms of aggression and violence like teen dating violence and sexual violence. But by the end of this keynote here, we're going to see that there's many more researchers that are taking on this line of research, and I'm hopeful that that will continue in the future. I will be presenting some data that was from grants funded by the Centers for Disease Control as well as NIJ, and certainly anything that I state here is not the opinion of these federal agencies, but what we glean from our data and our data analysis. So here at the University of North Carolina at Chapel Hill, as well as my work at the University of Florida, and then 20 years prior there at the University of Illinois, Urbana-Champaign, my lab and many PhD students and postdocs have really been trying to break down those silos. Dr. Sherry Hamby pushed us in prevention science to break down the silos around violence prevention, and we took this to heart. And so early on in the 2000s, we were looking at the ways in which bullying was a precursor to gender-based harassment, including homophobic name-calling, and really set the stage for the development of both teen dating violence and sexual violence. And so I'm going to give you the highlights of that research and kind of what this means for prevention science moving forward. But understanding that the world has changed since we started this work, and certainly there's more work to be done. So luckily, during the pandemic, I decided to really dig into the literature with my colleagues listed here and do a decade in review. So we were able to go in and do a systematic review to say, what is the evidence for the bullying related to sexual and teen dating violence? And so to just give you some sense of the scope of that review, so we looked at research from 2010 to 2021, largely because there wasn't a lot of research prior to 2010. There were some white papers and some positionality papers around this, despite the fact that some of our prevention programs were targeting multiple forms of violence. So we went with this time range. We found initially 505 articles, which included 17 meta-analysis and systematic reviews that looked at some of this component of bullying and sexual violence and teen dating violence. We found that 107 peer-reviewed articles really met our criteria because we wanted to look at the intersectionality between bullying and sexual violence as well as bullying and TDV. So some articles would do a pairing of that. Others had all three. But we also wanted to look at both the risk and protective factors that would amplify, if you will, these associations between bullying sexual violence and dating violence. But we also wanted to be able to inform theories and which theories have been used. And of course, I will not have time to go through all of those, but I do encourage you to check out that review article, something we feel really passionate about. In the mid-2000s, with my colleagues from Centers for Disease Control, Merle Hamburger, Kathleen Basile, as well as really some excellent mentoring from Dr. Nan Stein and her work, which I'll speak to later in this presentation. We were able to come up with what we were calling the bully sexual violence pathway. I, as a researcher, as a person that used to work in sexual assault and with domestic violence perpetrators, I started to notice some really interesting characteristics that we saw in kids that engaged in high rates of bullying and those intimate partner violence situations, whether they're perpetrators or victims. And we started to build this theory. And luckily, others were doing the same. So I come to this work with a lot of colleagues and students that have done some deep, deep thinking about these potential connections. Certainly, the theoretical frameworks that you'll see in the review span those that look at the parts of the social dynamic, the social ecology. Certainly, Deb Hepler and her work in Canada, who's looked at bullying and sexual harassment on the victimization side, implicated the schools as contributing to this association, but also peers and a developmental contextual framing. And also, our work has pointed to the training grounds for some of this is really in the homes, in the family context. So those are some parts of those ecology. Certainly we can go out to the outer rims of the Bronfenbrenner ecology as well. We do situate a lot of our work in the social interactional learning model in that kids somewhat mimic, if you will, those attitudes and those behaviors that they see in their home. And we have a complex model. Here I'm talking about the bullying sexual violence pathway, and will implicate some mediators and potential moderators of that association and extend it to teen dating violence, but know that our larger model really does point to other individual characteristics as well as those contextual characteristics and even the political climate, if you will. We have a particular interest and have since 2000 looking at both bullying and sexual violence and teen dating violence as a gendered framing. And so we talk about gender harassment, in which these behaviors in some ways reinforce traditional masculinity that is emotionally restrictive, competitive, and aggressive. It's a way of doing gender, if you will. And so those are some of the theoretical frameworks. You'll see more within the systematic review that I'm hoping that you will dive right into and assign in your classes for students to read. So a lot of the data early on, so I'm going to kind of talk about how we were able to get funding from Centers for Disease Control to track students from middle school to high school and Midwestern middle schools and high schools, and then also funded by NIJ to follow those kids up into those high schools. And so a lot of the data I'm going to show you here, just highlighting, we have many, many papers from these data, just highlighting that association and support for the bullying sexual violence pathway. You'll note that this particular population is largely white and Black. And I don't have time, but we're replicating some of this in our recent Colorado trial, which includes a high percentage of Latinx adolescents. And so look for the literature for that. We're very, very fortunate that the superintendents and the school administration allowed us to come in and ask sexual harassment, both perpetration and victimization, and also teen dating violence. And so very, very fortunate there to be able to tell this story. And some of our earlier papers in 2012 and 14, and more recently in 2019, really was kind of looking at this association between bullying, perpetration, and sexual violence. So we'll get to TDV and that replication later. In this short, brief talk, I'm just going to highlight just some stories here. This was a battle at every manuscript because we also had research program Paul Petit led there at the University of Illinois that showed that homophobic name calling or homophobic teasing was quite prevalent and often ignored by bully researchers. And so we first had to demonstrate that this was a phenomenon that was happening. And this was just a result of cluster analysis that showed, this is before latent class was a thing, but cluster analysis showed that upwards of 12% of both males and females were engaged in perpetrating kind of garden variety bullying. But when we looked at the extent to which they used homophobic epithets and directed those epithets towards others, we see that 1 out of 3 males were doing this at high rates, so that high cluster. And then females were also participating, which we also do know that girls police masculinity as well as boys. We had to demonstrate this for editors and reviewers to just recognize that homophobic name calling was worthy of study and not necessarily always represented in the bullying research that we were conducting. This was challenging and a little bit frustrating, given that we'd had Ian Rivers in the UK that had been studying homophobic name calling for the last 30 years, but it was challenging in the States to be able to ask these questions. We had to go even further and demonstrate that we're not just going to lump these homophobic name calling items into a bully scale, that they're actually distinct. And this is a model that was conducted by Todd Little, looking at our data, actually showing that bullying, although related to homophobic name calling, are not one and the same, and they should be treated separately so that we can understand what are those risk factors for kids engaging in bullying that's not so gendered, then moving on to calling each other homophobic slurs. So we demonstrated in this for a reviewer, I think, to show that we're not going to put these together, that there's something unique about homophobic name calling that is more gendered than, say, some of the other bullying items that we measure. So to take away there, homophobic name calling is quite prevalent. Some recent research that we've done in 2019 prior to the COVID, we're finding similar rates, if not even higher. Don't have a sense now because of the difficulty getting in to do this type of research right now into schools. But I'm hopeful that many labs that are listening to this can offer some recent data, maybe in the Q&A, or offer and see what you're seeing out in the field. So youth who bully resort to homophobic name calling over the middle school years. We've demonstrated that. And this is a bullet. This last bullet has probably been on my PowerPoint talks for the last 20 years, and I'll keep pushing for bullying prevention programs. Really do need to include the discussion of language that marginalizes gender nonconforming and LGBT youth or gender and sexual minority youth. And so this is especially critical as we have a lot of legislation coming out that's not allowing these types of curriculum within the bullying prevention programs. When we started to do this work, that's exactly where we're at. So it's kind of full circle that it's going to be challenging to do this work in some locations. We did extend this here that we had the bullying and homophobic name calling, but the homophobic name calling perpetration also then predicted sexual harassment perpetration over time. And we found that through the middle school years, and we also found that actually predicted 6 years later into high school. What this really points to is that we have to think about how can we target homophobic name calling or that gender-based harassment within the context of the work that we're doing. Now, this is fascinating. If you look at just for males, this association between homophobic name bullying and homophobic name calling and the probability of sexual violence perpetration. And what I want you to pay attention to is when, in fact, if you are low in bullying, but as you engage in high homophobic name calling, that increases the chances of sexual violence, pointing to the importance of not just targeting bullying prevention, but also making sure that we're talking about this language that marginalizes those that are seen or perceived to be gender and sexual minorities. We also find that bullying perpetration, as we've shown, is associated with homophobic perpetration, but we find that that mediates and increases the odds of sexual violence perpetration. And homophobic victimization, less of a mediator, but so clearly we have this trajectory of kids engaging in name calling around bullying, and then it leads to, and this is longitudinal, then it leads to directing homophobic epithets towards others, and then that is related to high rates of sexual violence perpetration, both what we call sexual harassment as well as contact or sexual contact as well. So a whole nother talk would be to think about the moderator. So I'll just highlight this. This is in the reviews, not just our work, but certainly the work of Michelle Ybarra, Tracy Valancourt, Stacy Horn, others that have looked at this, Paul Poteet, have looked at this association. And so traditional masculinity, or the toxic masculinity, is linked to gender-based harassment. So high rates of bullying in middle school and high levels of traditional masculinity predicted sexual violence perpetration in our studies, especially for males, but we're also finding this in other papers, and we've reviewed that in the review. We also find that this dismissiveness attitudes toward, so being dismissive towards sexual harassment, and my colleagues have done a wonderful qualitative piece in 2013 that I encourage you to look at. It's not just dismissiveness of sexual harassment of the students, but it's also dismissiveness of with the teachers, and that is associated with greater sexual violence perpetration, victimization in schools, as well as at the individual level. And so these are both moderators that can be addressed and has been addressed in some of the curriculum that some of you have developed and evaluated in this space, whether that's Green Dot that uses the norms, whether it's Coaching Boys into Men that's really addressing the traditional masculinity, shifting boundaries, other types of dating matters, right? So as we think, and we review those briefly in our review article, to just point to that a lot of what we're doing in the prevention space, whether it's bullying or sexual violence or the intersection of that, really is grounded in this research. So there's support for that over time. I'm happy to say that just recently, with some graduate students, we are able to extend the bully sexual violence pathway to teen dating violence, which I had speculated for a really long time, and we were able to find that was true. So we extended the bullying sexual violence pathway to teen dating violence. The results supported the bullying to TV longitudinal pathway in the data. Interestingly, the results indicate that preventing bullying perpetration may be one avenue to reduce TDV perpetration. But it was also very, very clear that sexism and homophobic name calling acted as partial moderators between the bullying and TDV, pointing to that simply doing bullying prevention void of a discussion of gender-based harassments and attitudes and sexism will be not moving the needle. We certainly need to think about bolstering the bullying prevention programming to include this content. Okay, so, when we think about our research, and I'm going to point to some prevention things for us to think about, and certainly welcome any comments in the Q&A to follow up, given the short amount of time that we have. But so we have to take a comprehensive approach that addresses, so I'm thinking within the school base, the climate that actually may give potential perpetrators a license to perpetrate both sexual violence or teen dating violence. We have to think about diffusing that risk for sexual violence perpetration later in high school and emerging adults, because we do know that TDV is predictive of interpersonal violence, but we actually need to back that up and do that work late elementary school, middle school, to address the bullying and address those moderators and mediators, if you will, homophobic name calling, to reduce the likelihood that kids will go on to perpetrate other forms of violence. I will say it again, but I think that we need to continue to think about how we can counteract perceptions of gender nonconformity in our programming. And certainly there's good examples out there, but I think we need to continue to do that work. We also have to think about multiple contexts to identify. I mean, I've largely focused on the school here, but I think we need to think about community. Some of our work has looked at the peer dynamic as really important contextually. We had a paper this last year that showed that those kids that engaged in sexual harassment actually were very popular and in dense friendship groups. Those that engaged in sexual assault or rape were not. They're quite isolated. So when we think about the multiple contexts, whether it's peers, it's families, it's schools, it's communities, now that we have this association of where can we really target our prevention science? And again, bullying prevention programs should address some of this gender-based name calling and sexual violence and gender expression that we have been saying for a really long time. I wanted to just back us up and put some context to this work too. This was, I say, a history lesson because Nan Stein had Expect Respect Elementary School project where she had the curriculum of bully proof. And note the date, 1997 to 2000, right? And they were developing bully proof to prevent dating violence, dating abuse by reducing the social acceptance of bullying and sexual harassment. So in some ways, our work has really just supported the work that Nan was way ahead of the curve on this in 1997 to 2000. The Expect Respect program has gone on to do beautiful things in the community, and I encourage you to just Google Expect Respect, look at the strong research associated with the different layers of that. It's a comprehensive approach. It's the multi-level intervention, classroom curriculum, staff training, policy development, parent support, support services. They've really taken the work that Nan and Barry Rosenbluth have done and really expanded it to think about. But I also just want to make sure that we understand that this work was being done prior to 1997. I was an assistant professor at University of Illinois studying bullying. And certainly this has influenced the ways that I was thinking about this. I also want to call to the field as Centers for Disease Control is really trying to understand what are the protective communities, the ecologies that we can draw upon to prevent both sexual violence and teen dating violence. There really is a focus around protective factors. And with my colleagues at CDC, Kathleen Basile and others, we've identified that empathy and school belonging is just two examples of protective factors that we could target. Interesting about these figures here is that when you look at the lower two lines, the dotted triangle there is the male perpetrators, and the 0 is them in middle school. The line above that is the female perpetrators. And again, that 0 is middle school, let's say 5 is high school, which you do note, I'll very quickly note that both male and female perpetrators of sexual violence start the lowest in empathy in middle school. And where the girls kind of catch up a little bit with the non-perpetrators, the boys continue to be flat. And again, this isn't a binary sense of how we measured it, so I apologize for that. And a very similar pattern for school belonging. So this points to continue to do the work that we're doing around empathy and perspective taking in our programming. It's always important, but also really consider school connectedness and school belonging as a ways in which to approach this. There's other protective factors, there's other risk factors, but certainly we need to think about the protective factors. And many of the prevention programs that are going to be discussed at this conference, I'm hoping that you will see little nuggets of these in there, and you'll think, oh, Dorothy talked about that as being particularly important. So protective factors are important to identify in order to prevent both bullying and sexual violence. And certainly we've replicated some of those same protective factors for teen dating violence as well. And again, just addressing empathy and school sense of belonging may actually prevent some of the escalation across the different types of violence. So as we're going to hear at this conference, this stuff we have to think about multi-level interventions in the real world, and Centers for Disease Control and Veto Violence has really outlined preventing teen dating violence requires change at all levels, with a particular focus on the community and society, like For the longest time, most of our programs to prevent both bullying, sexual violence, and teen dating violence has been in that individual and relationship. And then Vicki Banyan and Sherry Hamby have moved into the community. And now CDC is really funding those prevention programs that are on those outer rings. This is tough work to do. There has to be a long-term approach. There has to be relationship building as a protective factor. It's going to take, staff, resource-intensive teamwork. And if we looked at Katie Edwards' work out at Nebraska, would see that really building community, being collaborative, being inclusive, is we're recognizing that that's having to happen if we want to really have sustainable reductions in these types of violence. We have to rely on opportunities and champions. The days of us just coming in as researchers and doing randomized clinical trials and taking up instructional time are long behind us, I think. I think we need to think about real world and know that it's challenging to evaluate and reconsider some of our ways in which we think truth is and knowledge, and that's the randomized clinical trial, but thinking about building connections if we want sustainable prevention interventions. And so we need that comprehensive approach that addresses the school climate. Again, I do most of my work in schools. And so schools are important. Youth who are connected with trusted adults at school report less harmful behaviors, both as perpetrators and victims. So it's about building relationships. There's also characteristics, and we highlight this in our review, of effective prevention programs, involvement, leadership of community members. There's people doing this work in the community that are interacting with schools. We need to have that conversation. We need to think about sufficient dosage. And we're recognizing that some of our prevention programs take a few years, and sometimes they take longer than the grant cycles. We still have to focus on interpersonal skills. This is important to both reducing the likelihood of these forms of violence. Bystander approaches still offer ways in which to change the climate and the norms. I talked about the multi-level strategies. And then we really have to also think about dismantling the societal systems of oppression that are contributing to this gender-based harassment over time. And I wanted to end with this sentence that my co-authors and I really thought long and hard about as we were looking at the research across the globe on the connection between bullying and sexual violence and teen dating violence. And I'd like you to just listen to me. Prevention programming deployed in schools and other youth-serving settings must disrupt patterns where dominance behaviors, bullying and sexual violence, which we argue is a form of that, are rewarded, and instead foster cultures of collective care, empathy, and psychoeducation regarding the ways that oppressive symptoms shape interpersonal interactions. So I encourage you to go and read the review article. We expand upon this notion of dominance that undergirds both bullying, sexual violence, as well as adolescent relational aggression and teen dating violence. And I'm hopeful that this has been helpful. It's just amazing to me to think about in the early 2000s when Paula Poteet and I were sitting around asking middle school kids about homophobic name calling, which was not an easy task to do. And then really thinking about it as a precursor to sexual violence and teen dating violence, to have in 2022 a review article where we have our international colleagues now measuring this in their school-based studies. I have to say, it's a win. It's a win I'll take. But we have to continue to do this work. And figure out ways to protect the youth, especially in places where we're not able to do this work in schools. But find the youth, talk to them, involve them, give them support. So thank you very much. I appreciate your time and attention.
Thank you so much, Dr. Espelage, for that great presentation, and congratulations on your body of work. And for folks attending, we'll provide information about where you can find the systematic review she referenced in the presentation. Now I get to have a conversation with Dr. Espelage, and I do invite folks to participate. So please remember to send any questions you have for Dr. Espelage in the chat. And while folks are thinking, I'm going to take advantage and start with one of my own. So you mentioned recent data, and I do hope that folks will respond to your prompt, and if they have new data that they might be able to share. But I'm wondering if you've had an opportunity to see data from the latest youth risk behavior surveillance system from CDC, and I know they have questions pertaining to bullying or sexual violence or school connectedness. But was any of that recent data from 2021? Did it surprise you? Does it tell us that we're going in the right direction? Just wondering if you've seen it.
Yeah, absolutely. So for folks that haven't seen it, the reports of sexual assault are the highest that we've seen among females and gender and sexual minority youth. Of course, when you think about the YRBS, they're single items, so there's issues with reliability, but the rates have gone up tremendously, which is in some ways not surprising to me because there's very little prevention work across the country around Title IX. So one thing that I didn't talk about is that schools are required in this country, K through 12, actually K through 16, even higher ed, to address sexual harassment. It's federal law, but the last administration kind of did away with the Title IX guidance. And so there's been no accountability. And of course, then we had a pandemic, right? So our schools are kind of in panic mode trying to find their students and addressing learning loss. But at the same time, now we have this data that nationally show that we have to address sexual harassment and sexual assault. It's a cause for concern. It's quite alarming. So it's very sad.
Great. And so a question from the audience here. You mentioned late elementary school and middle school as an important time for intervention. Why is this window of development so important?
Yeah, absolutely. I think we've known for a long time. Of course, you guys are at Michigan, right? So some of the groundbreaking work of that transition from elementary school to middle school is critical, not only academically, but socially. And we're also seeing that sexual harassment is occurring younger. So in our data, we had fifth graders, and then more recently at high schools, but what's showing, of course, the YRBS is 7th through 12th grade. So we don't have a lot of data on that late elementary school. We just know that some of those behaviors are happening and that transition is critical. Now, I say that knowing that parents out there do not like for us to ask 5th and 6th graders around those items of sexual harassment. There's something about the sweet spot of 7th grade that parents are a little bit more open. But certainly I always kind of push for the earlier, just giving that transition that we know that elementary to middle school is a challenge in many, many ways. Yeah.
Great. And sticking on this topic of developmental stage, but in a different direction. So a question from the audience. Many students mention that their biggest bullies are actually adults in their lives, and that could be parents, teachers, or coaches. Do you know of any research or evidence-based interventions around that particular subject?
Yeah, so this is a tough one to study, right? Because many times, you could be in some districts where you just simply can't ask students about teachers and other adults of what's happening so I don't think we have a sense of how common that is, but certainly across the 25 years that we've done this research, when we do large scale quantitative studies, but when we do follow-up interviews, students will talk about teachers humiliating them within the context of the classroom. We had an NIJ grant before the pandemic where we were doing lots of work with high school youth, and they talked about the racism, the discrimination that they experience, not just from students, but also teachers. And I won't name the states and the schools we were in, but that was a common thing of just inequity, microaggressions, and it's real. I think we now recognize with coaches finally came on board about 10 years ago, recognizing that sport in general could be contributing to the high rates of victimization that we're seeing. And certainly there's high profile cases in higher ed and other places that show that coaches were sometimes the perpetrators of sexual violence. And I think that's true in the K through 12 settings as well. We just don't have really good data because of the difficulty of asking kids about that. And then the mandated reporting that we might have to engage in if they disclose sexual violence by the hands of adults.
All right, thank you. And just one more on this kind of developmental topic, mentions that it's perhaps outside the research focus, but do you know of any research at the post-secondary level? So that might be happening on college campuses.
Oh, absolutely. So you've got to remember that Title IX applies to college campuses and universities as well. And certainly folks, Jackie White and others across the country have done the school climate surveys. We say school climate on higher ed, but usually that's a Title IX survey to uncover sexual harassment. Just because you get a high school diploma doesn't mean that the sexual violence stops when you come to campus. And we found that in our studies. Paul Petit, Melissa Holt, and I looked at bullying as well as sexual harassment in higher ed. It's here. And in fact, we actually do somewhat of a better job on college campuses with the Title IX offices, if they're staffed appropriately, than we do in K through 12 settings, because there's just more accountability for whatever reason that is on campuses. So yes, it doesn't go away. And we know that as you matriculate out of college, and there's folks that study this in the workplace, right? So Louise Fitzgerald's classic studies have shown that the sexual harassment is alive and well within the businesses. So that's why it's also important to try to prevent these behaviors such that we can all go into the workforce and not have to manage sexual harassment or sexual violence. Great question.
You. And switching gears just a little bit, I saw in your summary and also in the literature review, societal systems of oppression and some of the inequitable outcomes for students with minoritized identities. And I'm seeing a couple questions here in the chat, but I particularly was struck by how bias and lack of awareness can make identifying and addressing victimization for oppressed groups a little bit more difficult. And so I was wondering if you could speak a little bit about the role culture plays when we are thinking about designing and implementing bullying or teen dating violence interventions. And I think we have a couple of follow-up questions here too on this topic.
Yeah, I think when you think back to the theories that I presented so briefly, right, that we have to think about culture and context. As I said, in North Carolina, it's a very different experience than the data that I presented from the state of Illinois, right? So, and we can think about other intersections too of culture within the family, those types of things. So I would say that some of their early on, our prevention programs kind of were void of considering those systems and culture and how that plays out. And I think that's probably why it contributed to, for example, our meta-analysis showed that teen dating violence, actually most of the programs did not reduce teen dating violence, actual behavior, but attitudes. And I think in large part because we are not uncovering where that violence is situated and really digging into that ecology. In that community and cultural context. And I think we're starting to do some of that work. As I alluded to, if you look at what RFAs are coming out of Centers for Disease Control, they're really pushing for us to go beyond individual skills, but considering the cultural context involving community members as well, beyond the brick and mortar of a school.
Thank you. And in a specific context here, a question about the importance of addressing societal level bias towards the LGBTQ population. And what can we do as researchers in the realm of bullying that tends to focus more on the individual school level? So I think particularly that population.
Yeah, it's a great timely question, right? As we see, I sit in North Carolina where they've just passed a bill where if a child wants to change their name or use different pronouns, the teacher is required to call home. And so this is real. And this, as in the YRBS actually also showed that high rate, 42% of LGBT youth had thought about killing themselves in the last 2 days, a couple weeks. So what you have to think about is that as these bills and the political climate is changing, we're sending a message to more specifically gender and sexual minority youth, that their identity is being silenced yet again. And so we're in 2022 and we're back to, and I have thoughts of being escorted out of towns and other places and asked to leave when I talked about the suicide rates among gender and sexual minority youth. It is distressing. So what do we have to do? So I'm not going to just focus on the negative. We have to be creative about doing this work. And it may mean that we take on the model of Liz Miller at Pittsburgh of maybe we go to the youth and we find the youth. And it may be, if you can't do that work within the K through 12 system schools, engage with your faith-based organizations, find the champions that are doing this work, and look to your peers that have been creative about how framing this work so that you are not shut down in the work that you do. I think we've got a partner. And so for those of us that are in the South, which are just really, we're marginalizing gender and sexual minority youth, as well as teachers, as well as individuals, we're going to have to be very creative and try not to get frustrated. So when I do get frustrated, I think about my work that I was doing in the late 1990s, and I just think, okay, we can get through this. But it's going to take many of us collaborating together and creativity.
Thank you. And I think this a related question, and kind of addressed here, but the role of state policies to prevent teen dating violence. You know, many states have anti-bullying laws or policies, but not necessarily policies addressing teen dating violence. Do you feel that that's accurate? And maybe comment on that question.
Absolutely, it's true. I think most of the time you'll see teen dating violence prevention kind of situated within health classes. And so I think of the work of Jeff Temple in Texas, who's been very creative in that conservative climate to be able to do teen dating violence, but within health classes. So usually the health education policies, we've got to push to update the health education standards to include interpersonal violence. And so making sure that we have a seat at the table when that happens at your state level is going to be critical.
Great, thank you. And let's see here. I appreciated your comment about relationship building when engaging in school-based research. And I've seen a couple of questions about some of the practical steps that we could be applying. And I'm curious if you could provide some advice to new researchers about the first few steps that they should consider when they are starting a school-based project or trying to develop relationships with schools.
Absolutely. This is critical that we have researchers that just think, okay, we're going to go in and collect data. You have to know that community. You have to know their needs. And so there's, in some cases in Illinois, I would go to basketball games. I go to school board meetings just to understand that community and try to become part of that community versus someone that just comes in to do the research. It's extremely challenging to be a school-based researcher now. We have moratoriums on research in some of the largest districts across the country. But just doing that work, but also educating for the assistant professors, educating your senior faculty about the challenges of school-based work. I did write an article that's entitled "What's Not in the Methods Section" with Katie Edwards. If you Google "What's Not in the Methods Section," we tell the truth. And so young scholars can benefit from reading that article. If you'd like me to send that, I can do that as well. A lot of lessons learned. We make mistakes, but I think that we have some suggestions moving forward for those that would like to do this work.
Great, and I think we have time for just one more question, and I'm going to piggyback a little bit on it because the person is recognized that schools don't operate in a vacuum, and they need to be considered within community contexts. And I'm just wondering, you mentioned this in your presentation, what are some of the challenges or opportunities for schools to join community-based efforts to reduce violence? Yeah,
I think that one, you need to figure out who are the agencies in the community that are already working with the schools, and to bolster those connections is critical. If we want to see violence prevention sustainable, we can't just go into the schools. We have to understand the stakeholders, and it's even more critical as schools are challenged to do this work.
Great. Well, thank you, Dr. Espelage, once again, and thank you, everyone, for joining us for this portion of this summit. We hope that you will stay for the concurrent sessions. We are now going to take a quick break and resume at 1:35 Eastern Time with the concurrent sessions. A reminder that you can find links to the session rooms in the session tab on the right of your screen. All of our sessions will be recorded, just as this one was, and will be uploaded to the website in the coming weeks. And lastly, we will be sending out an evaluation survey after the event, so please let us know what worked and what you think we could do to improve for our next virtual summit. So I look forward to seeing you all in the concurrent sessions. And one more time, thank you, Dr. Espelage, for your time today. I really appreciate it.
Thank you for having me.